So next, it is my pleasure to warmly welcome and introduce our two speakers today. So we have Gillian Carter, who is a senior lecturer in chronic illness. She trained in adult nursing and has been working in healthcare research for nearly 15 years. Her research focuses on enhancing the provision of support for family carers of individuals living with a neurodegenerative disease, in particular, dementia or Parkinson's disease. She also focuses on improving the awareness and understanding of these conditions within the general public of all ages and within healthcare professions. So she's joined today by Julie Doherty, who is a senior lecturer in the School of Nursing and Midwifery at Queen's University and a chartered psychologist. Julie's research focuses on promoting communication and shared decision-making between individuals receiving care, their family, and healthcare providers. Recently, she has been involved in the development and evaluation of educational web-based resources on advanced care planning for nursing homes and community nurses. And they're going to talk to us this morning about their journey through a decade and reflecting on the development, implementation, and evolution of the Comfort Care Guide e-resource. So thank you very much, and I'll now hand over to Gillian.
There we go. Good morning, everybody, and thank you for this opportunity to talk to you about this particular training program that was developed in order to support care home nurses to help to train them, to support them in order to hold those end-of-life conversations with family carers of individuals who were living with advanced dementia. Now, this particular training program has had several iterations over the last 10 years, and it's really become part of the family. It's been part of, I feel like I've grown up with it, and it's now, I've certainly, my career has progressed with it. So it's wonderful to have this chance now just to talk to you about our story. So I'm just going to provide some information on the background studies and the pro-COVID development of the program. There was a particular transition point in February 2020 that kind of turned everything on its head, as it did, for many of us. Provide some rationale about the choice of going online with the training program, the feedback from that then sort of ultimately led us towards developing a website with an e-resource. And then my colleague Julia is going to talk to you some more then about one of the particular studies that this training program was used in. It was a transnational study called the My Support Work. And then she'll also talk about the evaluation of the e-resource. And then we have some lessons learned and some steps that we want to get some advice on, actually, about the next steps for our work. So going back to 2014, I was a research fellow, and I was working with Professor Kevin Brazil, and he was the lead on this particular study in Northern Ireland, in which we worked across 24 care homes. And in this study, it was called Promoting Informed Decision-Making and Effective Communication Through Advanced Care Planning for People with Dementia and their family carers. Now, within this original study, we worked with a research nurse, a fabulous lady called Violet, and she was independent of all the care homes. And part of her role was to hold end-of-life conversations with family carers of people whose relatives had advanced dementia and were residing in the care home. So as part of this role, she completed some training to enhance her advanced care planning skills and also to hold these sensitive conversations with the family members. Now, prior to meeting the family carers, they were sent a very small booklet, a little A5 booklet, to help their education about the comfort care at the end of life for individuals with dementia. And this is referred to as the Comfort Care booklet, and I'll talk more about this as we progress, because it really has been a key theme throughout this whole training program. After they had the booklet, they then had a family meeting with Violet. We referred to this as a family care conference. And in this, they discussed those end-of-life care goals. And then after this meeting, Violet either contacted them and follow up with a phone call, or perhaps held another face-to-face meeting. And ultimately then that provided the documentation of any advanced care plan decisions. Now, as I said, with Violet, she had to complete some training. So we developed a training program And at this stage, it was focusing on the communication skills, knowledge and understanding of ACP discussions. So in this, Violet completed the Respecting Choices Facilitator curriculum, and that had different critical thinking modules, specifically designed for healthcare professionals to enhance all those facilitation skills that were needed for holding those sensitive conversations. She also completed some other communication modules for end-of-life care for all. And then there was another course called the Sage in Time ACP, and this was considering wishes at the end of life. So this was all the training that Violet completed, and it was also augmented with sort of local expertise on ACP and also dementia within Northern Ireland. So this really, in 2014, this provided the foundation training programme that the further iterations that occurred from that with the following studies. So after this, there was a transnational study in 2020, and it was a follow-up of this work. And again, this was led by Professor Kevin Brazil, and it was scaling up the family care decision support intervention, a transnational effectiveness implementation evaluation. And this was funded by JPND, and the UK element of it was also funded by the Alzheimer's Society. So the difference this time with this study, in the original study, we had one nurse, Violet, who was independent of the care homes, who went into the care homes, held those family care conferences and completed ACPs. Now, in this iteration, across all the countries, a member of each of the care home staff, so we had 7 countries, and there was approximately 2 care homes in each of those countries that participated. And the staff from that care home then completed training in order then that they could train other members of staff within the care home in order to hold these comfort care discussions, again, with family carers of those with advanced dementia. So that was a slight change this time around, this iteration. And as you can see, we worked with England. It had the care homes in Northern Ireland, Republic of Ireland, Italy, the Netherlands, Czech Republic, and also Canada. Now, as part of this, we obviously needed to create a training plan. We needed a specific training program. So the content, we had developed this fabulous 4-day face-to-face training plan. I'm sure you can work out where this is going. We had this wonderful 4-day training plan set up, and the content of this was based on that of foundation training that I spoke about earlier. And Violet helped us, our research nurse, she helped us to build on that particular training program. So she was guiding us through her training, the experience of facilitating those end-of-life conversations, and also the training that she felt would actually have been of benefit for her as well. So ultimately, the key components that were going to be in this training plan were the comfort care booklet, the family care conference, and then the trainer component. So I'm just going to pause a little bit here because I just really want to talk to you initially about this comfort care booklet, because this booklet has been, I have always said, has been the star of the show from start to finish. As I said, in the very first study, it was literally a little A5 color booklet that was sent out to the family carers. Now, this booklet was based on the 2005 Canadian version by Arkand and Karen. And that was the comfort care at the end of life for persons with Alzheimer's disease or other degenerative diseases of the brain. And in that original study, we did have to adapt the booklet a little bit so it was more specific for the Northern Ireland context. And then after the study, we were then able to adapt it further because we had then feedback from service users, from Violet using it, and other palliative care experts. And that sort of led to the current UK version of it. Now, within this booklet, there's 5 sections. We've got the natural evolution of dementia, decisions about the end of life, relief of symptoms, the final moments, and then after the death. And each of these sections, they're presented in very much a sort of like a frequently asked question format. And there's also sections in there, some areas that you can make notes as well. And Violet always said, you know, in that first study, she said when the family carers had read and received this booklet, she really felt like it helped her job so much, because when they came to the meeting, they were very informed, and she felt like almost all their questions had been answered in advance. So it was a really useful tool. So going back to this 4-day training program that we developed. So as I say, a key element of it was going to be about this comfort care booklet. So it was important, we felt, to provide a history of the comfort care booklet and how it was developed. So you're not just taking something at face value. Likewise, we provided research on the effectiveness of the comfort care booklet, because as always, it's really important to demonstrate evidence-based practice. And then obviously how it could be used to facilitate those comfort care discussions. And in that image, that is the front cover of the booklet that was used in each of the countries in that My Support transnational study. So in the other components then, we had the Family Care Conference. And again, we wanted to bring in the history of the Family Care Conference and how they were developed, linking into Peter Hudson's work from 2008. And mainly the structure of the Family Care Conference was discussed, looking at the convening, conducting, and then documentation of it. And again, we provided some information on the effectiveness of the conference, again, important to demonstrate that evidence-based practice. With this, we also had some role play scenarios, and we had some professional actors who then we filmed them doing different scenarios, just to give that context of how to facilitate and deliver the family conference, so you can watch something and sort of, again, the reality of how family carers may react to it. And actually some of these scenarios were based on events that happened with Violet in the first study. So we had examples of perhaps siblings disagreeing, if there was a rushed meeting, if the conference, for example, took place in a coffee shop, and also some sort of suggestions of positive and negative environments for conducting these types of conversations. And then the final component was that train the trainer element. And this was led by Professor Christine Brown-Wilson. And this was adapted from the Train the Trainer toolkit and the Knowledge Network, and that was NHS Education for Scotland. And the key component of this was to build on the nurses, their own skill set, and to provide them with a greater understanding about how other people would learn and the different learning styles. Then obviously this was also intertwined with how to deliver the family care conferences and also how to use that comfort care booklet. Now, I've put this slide in because, you know, this date just stands out in my diary. This was the day that myself, research fellow Adrienne, and our research assistant, Sophie, we had arranged to meet this day for the My Support study in order to finalise the training programme. It was all set in stone, we had it all sorted. But then, as we all know, COVID was on the horizon. We had hoped that this training programme was going to happen in April, face-to-face in Belfast. But at this meeting, the three of us just sat across the table staring at each other going, what do we do? What's the next steps? So this was a real sort of turning point for this training program. You know, we didn't know what COVID really was. We didn't know how long it was going to last. At this stage, our Italian colleagues, they had just entered a national lockdown. So we knew they weren't going to be able to join us at the training. And we didn't even know whether any of us were going to be able to have this face-to-face training. So we discussed this implications of the training. And at this stage, we cautiously agreed to put this online. And this is what we were going to suggest to the team. So the options we looked at, you know, this was all very new for us. We didn't know how to put something online. We didn't know the best way of doing it. So we thought about maybe putting it over Zoom. But then we were worried because obviously the different time zones, it wouldn't be practical to do that. Then we thought, can we record the training that's held face-to-face and then send that perhaps to the countries that weren't able to join us? But then they're going to miss out on that sort of interactive elements that were held. Then we thought, can we do it, you know, do it partly face-to-face and then some online? But again, we were worried about the sort of standardizations of it and whether everybody was going to receive the same information. So ultimately, we decided that we thought the best option was to deliver it entirely online. And this is what we were going to suggest to the team. So decided to put it online. Then it's like, how do we do that? What way do we do it? You know, how can we replicate this 4-day training event that was going to be held face-to-face? How can we put that online? And how can, you know, are we sure that our colleagues are going to be able to learn the content in the same way using virtual methods? So one option we spoke about, and this does make me smile, we spoke about MS Teams. None of us had used Teams. We didn't know how to use Teams. We didn't know what different interactive elements were in it. Office 365 wasn't a new expression then, whereas now Teams is, it's in our life on a daily basis. You invite it to Christmas, it's there all the time. But then, in 2020, we just didn't know whether it was going to be a viable option, and we weren't comfortable moving forward with that. Within Queen's itself, we were already familiar with a particular teaching platform called Canvas, and this is a virtual learning environment. And because we were familiar with it, we knew how it could look, we knew what we could put into it, and that everybody could access it. So we thought this would be the best method at this stage in order to use all those pre-prepared materials that we had for the face-to-face training. So the rationale for the Canvas, quite honestly, it was free to use. We used the free version of Canvas. It allowed this asynchronous approach, so facilitators could access it in their own time. It also has this sort of teacher view, this almost like Big Brother's watching you view, in that we could sort of monitor how the facilitators were doing and what content was being covered. There was also quizzes and discussion boards, again, trying to get a bit of interaction. And then we had what we referred to as Canvas champions in each country. So they could help oversee the training of the facilitators and any sort of, if there's any tweaks that needed added in for their particular country. So the training team, we recorded all our presentations, and we, to try and get that personal feel, we provided a video as well of it, again, just to try and encourage that interaction. Now, Julia will be talking more specifically about the My Support and the impact of that study in the training program. But towards the end of that study, we got some informal feedback specifically about the Canvas resource. And we spoke to the facilitators that had accessed it, including Violet, to get a little bit of feedback on it. And what they told us was they really liked the role play videos. They thought they were excellent. It really helped them to visualize possible scenarios. And they actually suggested some different scenarios as well. They said they would have liked to have met and to spoke with others, which we completely understood. They said the content was really useful, but overall, they weren't keen on the layout. It was difficult to remain engaged. And quite frankly, it was a little boring to work through. And you know what? I completely agreed with them. It was a means to an end at the time. It was the best option we had in order to ensure that the study could go forward. But it was very dry. It was hard to keep everybody engaged in it. And we now had this opportunity of actually developing this content into a website, into an e-resource instead, keeping the same content, but making it more aesthetically pleasing. So from that, we developed the Comfort Care Guide. And do you know what? If you want to try and get, if it's possible to have a silver lining from COVID, that's why that particular day in which we decided that we were going to move everything online, it really changed the trajectory of this training program, because I honestly don't think we would have considered this particular e-resource, that we would have put together this website if we hadn't have had to make that decision to move everything online in 2020. So now we're at the stage of this website, our Comfort Care Guide. The iteration this time was that it was now a standalone educational resource. And we developed this with a Northern Irish company called Morrow Communications. As I said, it used the same content as what was in the, if you wish, that Canvas module. We distilled that across, and it's presented as 4 bite-sized units. And these are self-paced, so people can access it whenever it suits them. And again, it was this blend of written work and also videos. And at the end of each unit, there's a short quiz. And whenever they complete the short quiz, it's just helped them to reflect on what they've done for the care home nurses, to see what they've learned, see how much they've understood. And at the end of all the units, they can then download a completion certificate, which is obviously very useful for CPD. So very briefly, these units, the first unit, again, based on the Comfort Care booklet. Again, we're looking at the evidence base and the development of the booklet, the information that's contained in it, how to use it, benefits of using it. And also we provided a section of frequently asked questions that family carers may ask in response to reading it. So a bit of a prompt list as well for the care home nurse. And again, augmenting this, we've added some videos. And these videos, it provides a lovely peer support angle to the resource, because in this we have advice and tips from our facilitators from that My Support study, just explaining what helped them with using the Comfort Care booklet. And we're also really fortunate to have a video of family carers' perspective of it as well. And this is just to demonstrate within the resource, there's a couple of different areas you can actually download a PDF of the booklet, and it's currently just the UK version. So in the second unit then was about the Family Care Conference, again showing the step-by-step guide how to facilitate a conference. We had some videos again about role play scenarios showing good practice, and I'll talk about those videos again in a second. And also again, some more peer support, again from our colleagues, providing some advice and tips on holding these family care conferences. In the third unit then, it was now focusing on those communication skills and discussing sensitive topics. And this was built on the REMAP framework, which was designed to help healthcare professionals hold these difficult conversations about palliative care, about end-of-life care goals. And also it highlights the sort of best interest decision-making, principles of good communication. And again, we had some more role play videos in which actually it shows when something doesn't go to plan, when it hasn't gone as well. Then the final unit was about reflective practice. And this is based on Gibbs's reflective cycle. And again, we have some videos in there of colleagues providing some tips on reflection. And then also, because we're not looking at a train the trainer element within this resource, instead we've highlighted how to support colleagues who want to learn about the Comfort Care booklet and the family care conferences, and also advice on supporting that positive working relationship. So I just wanted to highlight to you about the video content that was in the website. This whole process was very new to me about developing a website, and it was brilliant working with Morrow Communications because I just learned so much about it and the importance of different parts of it. So with the video content, the issue we had was the role plays that we had previously filmed that we used on the Canvas resource. We then found out because of copyright, we couldn't use them in the website. This was quite a headache at the time, but to be quite honest, it worked out better for us in that we re-recorded the videos and we actually updated them and added some more information. So last summer, we spent a few days doing this in-person filming. So I've learned all about the terminology. So we had the talking heads, in which you literally have somebody talking to the camera, providing information. We also did some voiceover audios. We were able to access a care home, as you can see Violet Graham in the photo there on the right, one of our care home managers. We were given permission to go into the care home to do some filming of the environment. And I understand now with B-roll in that how important it is to add, some realism to the resources. So instead of previously we had to use stock footage, whenever you have the B-roll, it really brings everything to life. And that's what we were able to do within that care home to add that angle as well. Then we had the situation that we needed to record all the role play scenarios again. So we needed to access 5 actors. We were really lucky, and one of the nurse facilitators, Kathy Knight, flew over from England. So she was happy to basically play her part that she had done in the study. So she was acting as a nurse facilitator in the role plays. And we recruited a colleague from outside of the school, and she actually completed her nursing at Queen's, but as an added bonus, she had a drama degree. So she was more than willing to act in the scenarios as well. Then, quite frankly, we needed 3 more colleagues, and we bribed them with coffee and cakes to help us out with the final 3 parts. And, it was fabulous. Our colleagues were remarkable in stepping forward and supporting us. What I want to share with you, which was quite funny, on the day that we were filming this, it coincided with, we have in the school, there's a simulation suite, a clinical skills simulation suite, and it's often used for films. And on this particular day, would you believe Pierce Brosnan was filming there, and whatever the film he was doing. And we did have this momentary conversation together of, do you think maybe we could, pop down and see if he'd be, willing to have a small role within the scenarios. But I was too chicken. We didn't do it in the end, but how fabulous that would have been. But anyway, so we completed all the filming of the videos. We had different locations, as I say, within the care home and within the school itself. And then finally, it was fabulous in that we were able to also do some talking heads over Zoom with a couple of colleagues that were involved in that My Support study. So we had one colleague from Italy and one colleague from the Republic of Ireland, who also provided us some information, which was super. And again, we had the family carer. So ultimately, this all led into the production of the website, which quite frankly wouldn't have happened if COVID hadn't have happened. So it's been a strange transition for us to get to this point that we have this Comfort Care website. So I'm going to hand over now to Julie, and she's just going to talk a little bit more about that My Support study and the impact of that work, and also on the Comfort Care Guide, the initial evaluation that we've had of it. Thanks, Julie.
Gillian. Okay, so Gillian has reflected on the development and the evolution really of this training educational resource, and as she says, over the next few slides I'll talk a little bit more about the My Support project and how this work really contributed to the evidence-based approach that's promoted then within the resource. And of course, even though the new resource has been a product of many years' work and promotes an evidence-based approach to these end-of-life discussions, we thought it was important to also evaluate this new version to make sure that it is easy to use and that the content is also relevant, because we did make some changes, as Gillian said, to those videos and things as well. So I'll talk a little bit more about the feedback we got from the care home nurses who engaged in that evaluation of the online resource as well. So in terms of My Support is really an acronym for a project involving the implementation and evaluation of the family care decision support intervention. And this is designed for family carers of residents with advanced dementia, with a view to promoting understanding and shared decision making around end-of-life care for their loved one. And there are three key aspects to the delivery of that project. And the first one was the training. It is necessary to train the nursing staff to aid the facilitation of these comfort care discussions. And we do know that staff sometimes feel unprepared for these, or may be reluctant to talk about end of life with family carers as well. So it's really a key component of this this project to deliver some training for staff involved in this. The Comfort Care booklet then, as was mentioned previously, is an educational resource for family carers, which was provided in advance of a family care meeting, which was the third key component of this project. And during the family meeting, individuals then had the opportunity to discuss their family members' end-of-life care and any questions that they might have had after reading the booklet as well. And a nurse then was there to facilitate that conversation and respond to any questions. And we know that the Comfort Care booklet was seen as a key component, and that lots of people said how useful that would be to share it with lots of family members. But I also think it's important not to forget the family meeting, because what we were hearing was that the opportunity to sit down and talk with a nurse was equally important, because the booklet itself may provide information, but it also can raise questions and that sometimes need clarity, and that requires a discussion with someone in the care home as well. And that meeting then could also advance into discussions about care and maybe developing or contributing to the individual's advanced care plan as well. So I think one of the key reasons why family carers really liked this intervention is that they did have the sole attention of a nurse during that family meeting, and they were given information that helped them prepare or feel more at ease with this type of conversation about end-of-life care. They were listened to and just generally felt more informed as well. That's a very brief overview of the project and some of the things we found. In terms of its evaluation then, the evaluation was undertaken in 6 countries. So it was done in the UK, the Republic of Ireland, Italy, the Netherlands, Czech Republic and Canada. And we did use a range of strategies to evaluate this work, but the main approaches in terms of understanding its outcome was collected through interviews with family carers. We had interviews with the nursing home managers, staff who were involved in its delivery as well, external facilitators who were there to support staff as needed to deliver this work in practice, and also other community healthcare providers. We wanted to get a well-rounded idea of what people thought about this intervention or this programme of work and its application to practice. We also then collected some questionnaire data, which gave us some insight then into family carers' level of decisional conflict. And this was really to explore before and after they participated, what their views were in relation to care options, what was their understanding of those care options, benefits, the risks, side effects, and how satisfied they were with the choices that they had or had not made up until that point. We also looked at the family perceptions of care scale, and this asked family carers then to rate how they felt about the care that was being given to their family member in the nursing home. And it looked at whether some items like whether or not they felt their family member was being treated with dignity, if staff were sensitive to their needs, or if they knew or understood what to expect as their family member came closer to death as well. So there was a range of things assessed in order to determine the impact of this work. Gillian, can I ask you to move the slides, please?
I'm trying to, Julie, but don't let me.
I just went ahead and kept talking there and just realised the slides haven't moved.
I thought you had been able to move them on. Here, let me try again. Here we go. Right, sorry about that.
And another one.
Right, there we go.
And one more.
Okay, there you are.
Thanks, Gillian. So yes, that was just a brief overview of how the work was evaluated and some of the strategies that we use to determine its impact. And what we really found was that the approach adopted in this comfort care approach did have a positive impact on family carers. We found that it did result in less decisional conflict, which meant having this opportunity to talk to staff and access to the book meant that they felt more informed and clearer on the choices that they have made in relation to their family members' care. They also reported more positive perceptions of care, suggesting that this opportunity again supported shared decision making and had a positive impact on how they felt about the care their loved one was receiving and would receive at the end of life as well. Some of the other key factors that sort of came up during these discussions was that it was apparent this approach, and again I think facilitated the idea that it developed or trust and supportive relationships was facilitated by the idea that they were able to have a sit-down conversation with a nurse and talk solely about their family members' care. So that helped to develop trust and supportive relationships as well, which then ideally will support ongoing communication and shared decision making. It was also obvious, I remember many conversations where people talked about how it relieved their concerns in relation to some of maybe the care options that they had decided upon, or it maybe just helped them feel a bit more reassured about the comfort care and the end-of-life care that their loved one would receive. And of course, there was a desire then for others to benefit from the intervention. Family carers did indicate that it would be useful for others to have this opportunity, and staff were keen as well to integrate this into practice. But of course, there are always barriers to achieving things like that, and time was a major challenge, and we recognise that adapting the process to local context will be really important moving forward in terms of any implementation. So in terms of the new resource then, what we learned is that there is an evidence base to approach there is an evidence base to support the approach, the comfort care discussions approach. And a training and educational tool then has evolved over the years. So there is an evidence base to support the approach, and we have been evolving this training to ensure it meets the needs of nurses as well over the years. And we have generated this new digital version. And the new version has some changes to it in terms of scenarios and videos and things as well. We wanted to, with lots of research, when we develop anything new or make changes, we always want to check what people think about it and evaluate it in some way. And we recently did this in May 2023, where we had approximately around 32 care home nurses from across Northern Ireland complete the resource and then provide feedback during a discussion as well. So those discussions really looked at their impressions of the resource. What did they think about it? Did they like it? Did they like the content and the design? How relevant did they think it was to their practice and to them? And also if they felt there were any changes that needed made, because as you can tell, we are constantly evolving anything that we develop within the research as well. And overwhelmingly, what they said was they thought the e-resource was really useful and would be beneficial in practice. So that was great for us to hear. They did like the interface. They thought it was easy to use. And there was some discussion about sort of the layout and things as well, and how that just made it more engaging, having the text and the videos integrated there as well. And we have some quotes on screen that demonstrates that. So for example, someone said, we would actually use this and this would be really beneficial. And another, I actually really genuinely enjoyed working through it. There was some discussion around who might benefit most from this resource. And of course, they felt maybe nurses who were new to the nursing home, for example, might benefit from this, or those not already engaged in end-of-life discussions as well. There was also the suggestion that although carers may not be involved directly in these discussions, that it would be useful for carers to also have access to this resource. There was some more discussion about sort of increasing awareness and understanding of end of life. And I think one of the key points that was raised during the discussions that perhaps we hadn't considered was maybe cultural differences. And there were some nurses that talked to us about how they found this resource particularly useful because the discussions around end of life may not have been a process that they would have engaged in previously, or that they were familiar with due to just cultural differences in end-of-life care. So in terms of implementation and implementation of this resource, then some of the things that were raised for us was how best to use this resource. We have developed it as a standalone website that can be provided to staff as an educational resource, and of course it can be used in that way. There are others who feel that in terms of implementing this training or this information and building capacity within nurses for end-of-life care discussions, that a blended learning approach might be better. So staff have the opportunity to review the content and then they can come together within their local context and they can have a facilitated discussion, which sort of brings that real-life application as well to the care home context, which nurses really seem to like. And finally, then, what other option or other way that this resource could be used is through facilitated discussion. So there were certainly people who would have said to me that they intended to use the resource, so present it to their staff during an internal training session. And of course, that's another way it could be used. So in terms of what's next, sometimes we're not quite sure, but we're keen to share the resource as widely as possible and continue to seek feedback. It is open access, it is available for use, and there's a feedback form on there that we will monitor and then make any modifications as necessary. One of the suggestions from the focus groups recently was to adapt the comfort care booklet and the resource for other conditions. That's possibly future directions as well. But we're still really looking at what's next as well for this resource. So in terms of tips, or what our advice would be to others involved in this process for the development of any resources. Be flexible. Adapting is an essential part of the research process. Look for opportunities. Sometimes challenges will present themselves, but quite often they actually present an opportunity to evolve and actually maximize the real life impact that the product can have. And of course, PPI involvement, engaging with others, and including those who the resource is intended for in its development and evolution. And hopefully we've demonstrated today that over the course of the last number of years that this resource has had user involvement in its development. And finally then, just to seek colleague support, because many colleagues have hidden skills, and as Gillian said, we had many actors among us that we didn't know, but we're very helpful and supportive in terms of this resource. So that brings me to the end, and I just have a few questions for the group. It'd be great to have a discussion and find out what you think of the resource, maybe how best we can promote it or use it, and also whether or not you think the resource would support professionals delivering end-of-life care. Thank you.
Great. Thank you so much for that. That was really interesting. And I've been aware of the comfort. I've been aware of my support since for my entire time at the Institute, but this is the first time I've heard in such detail. And I've really enjoyed that. So you can put a question in the chat, or you can raise your hand, and perhaps if we stop sharing for now, so we can, and anybody who's happy to turn their video on, please do. And if you raise your hand to ask any questions you have, that should be hidden in my screen. It's under reactions. I can raise hand, but if anyone's struggling to find that, you can unmute yourself and speak up, because we're a nice small group. Anybody want to volunteer to go first? I mean, I've got lots of questions, but
yeah, I'm ready to try to find the raise my hand there.
Oh no, go for it, George. Go ahead.
It's great to hear that story right from the beginning. Over the COVID and the development pathway, I had a small role to play, and I was glad to see the thing all coming together. And I did have a question about where next, and also something about culture and something about context. So yeah, I'm getting ready to teach evidence-based practice next week, and the evidence part is pretty clear, and the evaluations are very positive, but evidence comes from different places. You have to have contextual positioning, and you have to have like a warm receiver of the evidence to take it forward. So there's something about how to take it. What were the main sort of contextual things? I suppose people are busy in care homes. The staffing changes quite a lot. There's pressures, and you wonder whether this kind of development might be kind of just in time, or being able to tap in when just in time, whenever the person is deteriorating, or at a particular admission, or triggered, rather than trying to design education that is very, very well designed and evidence-based, but in terms of the person receiving it, we may need to think of particular hooks that when to promote, or when's best to use. So there's that. And I'm interested in the cultural. There was one comment on the screen about cultural differences. I mean, I don't have any culture, but I think culture can be. That's what I mean is culture can be hidden, and I suppose there is that awareness and fit of this kind of intervention to a particular culture. So I suppose that's work in progress as well. But be glad to have a bit of chat about either of those things. So difficult context in care home settings, and not just cultural differences, but so bringing culture in a way that promotes the use of this. Good stuff.
I totally agree, George. Thank you for that. Whenever we held the focus groups, it was the comments from particular group that I was holding. It was really interesting because it wasn't something that we had thought of. There was a few of the staff there that weren't from the UK, and they said how beneficial they found it in order to understand our culture with regards to having those sensitive conversations about the information that's needed. And quite frankly, that's not something we even considered whenever this was, put together. So that's a real strength that's accidentally come out of this. It wasn't something that was, at the forefront of our mind. Whenever we were talking with the care home staff, obviously, as you were saying, like the next steps is, how do we get this out there? How do we, ensure that this is used? And, when I was chatting to them, I was saying things like, if I came in to the care home and had a meeting with you, told you about this, etc., would you listen to me? And they said, no, we wouldn't, because they'll be too busy thinking about what else they should be doing, the care plans that they should be writing, etc. And I said, absolutely, I totally understand that. I said, if we had posters up, would that help? And they're like, no, we will just walk right past them. So very much I was like, how can we get this information out? And, one of the things they were suggesting, I think there's a lot about peer work there, about getting colleagues who have used it to recommend it. And also, this is something completely not in my field, is this idea of social influencers. That's another area that they say, they say more often than not, they're on different apps, they do different resources, that tends to be who they listen to, because within the care home, they don't have the time. The time's not there, so I think that sort of provided us with an interesting angle to think about, because that resource is there now and we want to get that resource out, so that's really the next step for us.
Yeah, I remember doing some work on CD and thinking that all we had to do was send out the information on CD-ROM, and that would be the answer to advanced care planning. But the uptake was next to zero.
Yeah, that's
we didn't even have the kit to put the CD into. So
yeah, it's very true. Very true. It's a whole new ball game now. There's a whole different angles that we have to look at.
Yeah. Absolutely. Thank you.
Great. Natasha, you had put a question in the chat. Did you want to follow up on that?
Hi, thank you. Yeah, great presentation. And similar to George, my sort of ears picked up about when you mentioned the staff not from the UK, and they found the remap framework really useful. Is there any, maybe not in this, but in a future training sort of scope to consider how the culture of the patients or the families could maybe influence their expectations and engagement with the ACP process?
Yeah, I absolutely agree. I think, as I said, it's an unexpected angle. So I do think that's something that would be a very novel thing to have in the resource as well, is recognition of the international staff. If we're just looking specifically at the UK initially, absolutely, there's to recognise the volume of staff that aren't originally from the UK. And I think that perhaps would be a very interesting angle to bring into it, to talk to more about them and say, what would be beneficial? How could we help you further? Is there additional information within this that we can add? Because that was, because of the different cultures, definitely with respect to that discussion about death and dying, in some cultures that just does not happen. It's not respected. So, I think appreciating and understanding other cultures, I think would be a really important step within this.
Great. So did anybody else have any questions they would like to pose now to our speakers? And as I said, if you can't find the raising hand, just unmute yourself and speak. Oh, Joanne, are you ready? Great.
I am. Sorry, apologies. I kind of missed the start of the presentation, but I'd just be very interested to know where, you probably mentioned this earlier, where you can access the resource. Is it on the All-Ireland Institute website?
I have just put a link into the chat, and I think just if Gillian can confirm, the the website, the www.comfortcareguide.com, if that's the correct link for directly accessing the resource.
Comfortcareguide.com.
Yeah.
Thanks very much.
Great. Can I follow up with a question there? So you've clearly, like, you know, you've talked about a journey of a decade, and you've clearly stayed really engaged with this work. And can you tell us a little bit about what it's like for you as a researcher doing that? Because I love, Gillian, what you said about where you were going, shall we put up posters? Shall we do this? You know, just really going, how do we get this out there? And I guess a lot of researchers, they've done the initial research, maybe they've got a paper and they're not sure what to do next. And so what has it been like for you to have that satisfaction of seeing it going out, but also what support do you need in order to be able to do that as a researcher?
Yeah, I think it's a $1 million question. I think it's asking the people that are going to be accessing it, how, you know, what can we do? Because I think some of the approaches we're using are completely ineffective. You know, they might have worked 10, 15 years ago. Now it's not an option. So I think as a researcher, it's recognizing the differences and moving with the times as well. Like, trust me, I don't use social media. I don't use Twitter or X, whatever it's called now. You know, so it's very much, it's a learning curve for me as well. I'm sure for Julie too, just to understand, right, those traditional angles perhaps aren't appropriate now. There's, you know, everything has moved on, everything has changed. So I think that's the crucial bit now, is to make sure we've got the right approach, because we have this magnificent resource, you know, and I hate the thought of it just sitting there and not, you know, using it. So it's like, as researchers, you almost have to become experts in market research as well, you know, and being able to do marketing, you know, is a whole other area to learn about. But that's when you sort of lean on the people that, as I say, those, you know, we're talking about the hidden skills. You lean on those people that have those talents, that have those skills, that help to sort of introduce different ways of approaching that, you know, wouldn't be familiar with. Never in a million years would I have thought of a social influencer. You know, that's, you know, a whole new language for me. I wouldn't know where to even start with that. But I know there's colleagues in the school that do know how to do it, you know, so I do think as a researcher, that's the way forward. Way forward for me. I don't know if Julie feels differently, but that would be certainly something that I would consider.
I just noticed that you said how much support you got from Morrow, and I agree with you that sometimes you have to become multi-skilled as a researcher, but not everybody might be comfortable with that. And so I think it's thinking also about at the funding application phase, who might you need, what other skills might you need, and trying to get, you know, funders. I think when you put that in an application that you're asking for resources to deliver the impact, I think it's sort of seen as really giving credibility to the fact that you are intending to try and get impact out of this. But yeah, having that funding to go and get those experts involved is fabulous that you had that. I don't know if Julie, had you got anything to add there?
No, nothing to add. I think it's just, I would just reiterate that is the challenge sometimes for us, is translating that and sharing that more widely. I think absolutely building into the funding process is a great idea.
Great. Did we have any other questions or comments or feedback for the speakers? Oh, Natasha, please.
It's a bit of a cheesy question, but I've been asking a lot of people, if you could go back to yourself, you know, that meeting you had on the 28th of February 2020, and you could time travel back there, what would you say?
I think I think for everybody, everything was such a learning curve, and just basically say, you know, it's going to be all right. You know, an online resource is the way forward, you know, for this work. I think then everything was just so uncertain, you know, everything would just, so I think if I went back and said to myself, it'd be like, you know, be brave, take that step, it's okay, you know, this is going to be the future, quite frankly, you know, e-resources and online and Teams and Zoom, you know, that was the way forward. So I think that's probably what I would say to myself, that just to, you know, you just have to move with the times, you know, you have to be flexible. Yeah.
Great, thank you very much for that. So we're just coming up to time. We will share the slides and the recording. And I just want to say thank you so much to Gillian and Julie. I really enjoyed that. And thank you to everyone for joining us today and getting involved with the discussion. And we look forward to seeing you at one of our future webinars.